Tremor is a common symptom as part of functional neurological disorder. People commonly experience functional tremor in their hands and their arms, but they may also experience it in their head and neck and trunk. You may withdraw from your normal activities because of the tremor and a fear of hurting yourself, or the tremor may cause you embarrassment. Tremor entrainment, competing movements, and relaxation are some key strategies that can help with functional tremor. Things that can be unhelpful when you have a functional tremor are bracing and suppression of the tremor. For example, holding tightly onto the arms of the chairs to stop the tremor. Crossing your arms tightly against the body. Sitting on your hands. Or crossing your legs tightly to stop tremor in your legs. Placing your hands in your pockets. Breath holding when the tremor increases. Or avoiding standing or stopping using your arms and hands in daily activities. There are a number of strategies that can be helpful to manage functional tremor. Use of competing movements such as finger taps, rhythmical thigh rubbing. With the thigh rubbing, you can experiment with speed. You can do it quickly and then slowing it down and changing it up again and slowing it down. Rubbing of arms in a slow rhythmic pattern and then slowing it down. Sliding your hands on the armrests of a chair, again at different speeds. If you have tremor in your legs, it can be helpful to tap your toes. Or to tap your heels. Moving your thighs in and out. If you have tremor in your hands, your arms, or your legs when you're standing to do something, weight bearing through your arms and through your legs, whilst transferring your weight and regulating your breathing, can be helpful to help settle the tremor. Nice, slow, rhythmic movements. You can experiment with coming through your toes and over your heels as well. If you have tremor in your hands and your arms, then experimenting with different movements can be helpful. First, try making big movements with your arms in different patternings, and then make the movements smaller. You can experiment with speed and slowing it down. It can also be helpful to use distraction techniques, such as noticing details in your environment, such as sounds around you, what you can notice in terms of sights in your environment, what can you smell around you. Another distraction technique can be counting backwards by sevens, word association games, for example, countries, foods, starting with a letter of the alphabet. When you are completing day-to-day activities, it can be helpful to try and reduce tension in the body. Try not to grip items too tightly. Regulate your breathing and relax the body. If you have tremor in the hand or the arm, it's really common to try and brace against the tremor by holding a lot of tension in the upper body. We actually want to reduce the tension and reduce the grip strength. Grasp things with a normal grip, not too much tension in the upper body. Again, if you have tremor in your hands and your arms, it's best to try not to look at what you're carrying. So try not to look at a plate or a cup in your hands, as this can make the tremor worse. Rather, what we're trying to do is to focus on your environment or focus on the destination, i.e. where you're carrying the item to. Taking the focus outside of your body into your environment can help reduce the tremor. Start with tasks that are easier and then tackle more difficult tasks as you get better control of your tremor. For example, if you often spill hot drinks, you could start your practice with using the previously mentioned strategies and carrying cups of cold water. Then progress to warm water, then hot water as you get better control. Remember to look where you're carrying the cup rather than looking at the cup in your hands. Try to relax your upper body and regulate your breathing. If you are having difficulties with handwriting because of your tremor, it can be helpful to start firstly using a thick pen and large lettering or patterning. As you get better tremor control, you can then gradually reduce the size of the pen, the size of the lettering or patterning, until you progress to more normal handwriting. If the tremor starts to interrupt your writing, then stop the task, put the pen down, sit back in your chair, ground your feet, and relax your upper body and control your breathing. You could then try to use rhythm or entrainment to help with the tremor. So that could be rhythmically rubbing your thighs or your arms, controlling your breathing while you're doing it, trying some of the finger tapping. And then once the tremor is more settled, you can then restart the task. You may need to stop and reset a number of times whilst you're working on fine tasks such as handwriting.